At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Hormones, Menopause, Andropause, and Beyond on Wednesday, November 13th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey, everybody. Welcome to Dr. Tom Roselle Live. And it's a beautiful day outside. Gosh, I wish I was doing this outside from a tent somewhere and then we could all talk to each other and have some fun with it. But it is gorgeous. So make sure that you go out and make it happen. I think I'm going to go out to Shenandoah afterwards and watch my grandson play football. But that's we'll see what happens afterwards and get done with the live stream. Don't forget, as soon as we're done here on 105.9 WMAL, join me on the live stream. And all you have to do that, by the way, is go to drtomroselle.com. You get on your phone, you can get on your computer if you're sitting at home, and go to the live stream app, hit it, and you'll come up immediately. So here's the other piece of the puzzle. If you like me on any of the social media platforms, whether it's Facebook or Instagram or X or LinkedIn or whatever, I'm on all of them. We will let you know when the program is available and goes live. So that way you don't even have to think about it. You just say, oh, guess what? He's there. And we'll make that happen for you, right? So, and all the past programs are there. Go to drtomroselle.com. You'll see podcasts, all the radio shows, and you'll also go to the live stream programs. We've got some great stuff there. Take advantage of it. We do them for you. We make sure that you have the availability, if you will, to learn and to understand and to ask the right questions from your physicians. Because you know what? If you listen to me all the time, if you listen to me every Sunday, or if you go in and you go back in and look at all the things that we put out there, you will know, I promise you, you will know far more than 90% of the physicians that are out there, because that's not what they focus on. They focus on this drug for that situation. So what are we going to do today? We're going to talk about something that unfortunately there was way too many people that get themselves into this type of condition, and they have a very treacherous and tenuous existence once it happens. What are we talking about? We're talking about osteoporosis. Not fun. It's not fun, not even a little bit. And it's going to be on the 13th of November. We will be doing an in-house program at the Roselle Center for Healing in Fairfax on this, on hormone dysfunction. But we're going to be talking a little bit about osteoporosis and all about your hormones. So you kind of see, we're going to talk about that today a little bit as it relates to your bone density. And guys, this is about you too. This is just not about the ladies out there. You break bones all the time. And we're going to talk about the different situations that may exist as a result of it. A lot of it is hormone and different hormones. We're talking about estrogens and progesterones and testosterones, but we're also looking at something called parathormone, and that has to do with your parathyroid gland. But let's get into the program just a little bit. And in the live stream, I'm going to actually tell you about some of the things that you have to do to stop this in its tracks and to reverse it, because the greatest majority of all of these conditions, these osteoporotic conditions, are highly reversible. So let's deal with that. Let's talk about the hormone. So what's the symptoms to begin with? Well, if you watch yourself, you're bent over, right? Look in the mirror. Are you bent forward, or are you standing up nice and straight where your chest is up, your shoulders are relaxed, your head is pulled back a little bit, or are you stooped in your posture? Pain is associated with fracture, or cracks, or just the covering of the bone. The periosteum, peri means around, osteum means bone, can be pulled because of the shrinkage of the bone itself. We can get shrinkage, we can get fracture, we can get a lot of different things like that. Your hip fractures, or cracks or any bones, they heal very slowly compared to what they should be. And we start seeing these cracks. You go to the doctor and he says, well, you have the beginning stages of a wedging. Let me interpret that for you. Wedging means that your bone is breaking and the front part of the bone, the body of the bone is beginning to, just kind of slowly become more of a angular, triangular type of thing. So, you see a lot of different things that come about. And by the way, here's some other things that are associated with it. You get anxious. Yeah, we're talking about anxiety. You get depressed. There's pain. There's, the stress levels are pretty much intolerable. And then you have fatigue patterns that come about, and they're all intimately associated. If you've been listening to the program, you know that body hormone production is dependent on other things working properly. What are all those other things? We're talking about neurotransmitters. We're talking about enough protein in the body. We're talking about enough vitamin D. We're talking about other trace minerals. And we'll show you what that is that night here at the center. But we're also going to talk about how the hormones affect all kinds of different things. Remember, we talked about andropause and menopause. So osteoporosis is not one of those things that you necessarily have to experience, although way too many people deal with it. Women, obviously, more so than men, but guys, you're breaking bones too. You're getting shorter as time goes on. Why is that? Is it postural? And you have that overpaid for belly that's around you, so it's pulling you down. You're not in shape, so the muscles of your spine are not pulling you back. Or is it simply that your bones are shrinking and that vertical dimension is getting less and less and less as time goes on? So that's what we're going to get into a little bit today. We're going to talk about a little bit about the treatment in the second part of the program on the live stream. So I want you to join me there. But if we go into what's called post-menopausal, that means your hormones, you're going through that transition, guys. Post-andropausal osteoporosis. Remember menopause, andropause? You guys, we have it as men, women, obviously, you're the least paid for in the healthcare arena, so everybody focuses on you. But here's the deal. Post-menopausal, post-andropausal osteoporosis is a process, a condition, and I said process on purpose. It's a process that bone does not metabolize the way it's supposed to. See, what happens ongoing over a period of years, from the time that you're a little guy to the time that you're old and you leave the planet, is that bone tissue exchanges. Good guys come in and bad guys go out. Okay. Good guys come in, bad guys go out. So you get rid of the old dead bone. It's called osteoclastic activity, and you repair it. Post-menopausal, post-osteoporosis condition is often directly related to the hormone estrogen. And it means that there's not enough sometimes. Sometimes it's not buffered the right way. But remember, I said, keep your eye on that other organ called the parathyroid glands. They sit behind the thyroid. They are responsible in great amounts for the input of calcium into the bone. So we all have that. So if you're struggling with a thyroid problem, the chances are that your parathyroids aren't working quite as well as they should. With guys, if your doctor's, if he hears your heart flipping around a little bit, or you start, saying, I may have this problem, they do a calcium score test. The calcium level's way too high. Now you have to rule it out. How do you rule it out? You run hormone tests that have to do with the parathyroid. You do that, and if they're way elevated, too high, then the next step is, what's taking place. So they do surgery most often, and they take out the parathyroid gland. But now you really made things even worse, because now your bones are going to be problematic. It's not just that they're saving your heart, but your bones now are going to be more susceptible to breakage, if you will. So when we talk about osteoporosis and menopause, osteoporosis and andropause, there's things that you can do to protect yourself as well. Now, we know that there are several things that you have to have. Vitamin D is one of them. You're probably tired of hearing me talk about vitamin D because I've been talking about it constantly since the beginning of COVID because it's immunological, it's doing, it supports all kinds of other hormonal pathways. This is one. You can't put calcium into the bone without vitamin D. So we know that. If you're a cigarette smoker, you're going to run a much higher risk of osteoporosis. It blocks the ability, and drinking alcohol as well. If you're avoiding tobacco and you're drinking alcohol in moderation, you can have a glass of good red wine. Unfortunately, you got to be real careful in this country because they have high levels of glycophosphates, particularly in California and so forth. What's that? That's called Roundup, and it can cause damage to your body. But if you want to get some, you get a glass of wine, nice red deep wine from France, the Bordeaux, the Graves, the Italian wines, and so. But you still got to check them out, and you're moderate in that, and that's not going to be a problem. And actually helps other things. That's your resveratrol, and I'd like mine from a glass of wine, but that's neither here nor there. Exercising regularly, including weight training. Now, you don't have to do heavy weights. You don't have to be an Olympian, but we're going to talk about that in the live stream so you understand what it really is. And we want to make sure that you have adequate amounts of calcium. Don't need a ton, but you need some. So those are just the touching the top of the puzzle, if you will. And then we'll talk a little bit of hormones in the second part of the program as well. Again, in November, when we're in-house and we're going to be doing the program here at the Roselle Center on the 13th, we're going to be talking about all of these things and how the hormones interrelate and what you can do about them to fix them. And is hormone replacement therapy really necessary? Or are there other things that you can do to make sure that you don't go down the tubes? Medically, you have bisphosphonates, which I don't like personally because they can cause all kinds of inflammatory reactions and cancers and autoimmune diseases and so forth. And we have to know about that as well. So we could do like 3 nights on the subject, right? But you have to make sure that you get it. And there's things like calcium spillage tests, calcium scores that we can measure specifically. So we have a predetermination of what really is going on. But let's get back to this a little bit. And like I said, we're going to cover much more of it as we go into the live stream. So please, please, please join me. Just don't go away. I want to give you as much data as I possibly can, but at least to provoke you. Remember, my job is to stir it up and to make you ask the right questions. And, if you ever have a question on your mind, you want to know a little bit more about what we're talking about, simply do this. Go to drtomroselle.com. That's DRTOMROSELLE, and let's make it happen. Let's answer the question. Let me point you in the right direction. And you don't have to believe me, but it may get you thinking a little differently than what you're thinking now. And that's the whole deal. That's what I want for you. That's what I want to make sure you get. You understand that you have options when it comes to protecting yourself. And the more you know, guess what? So remember my book, right? Ageless Health. Health is a do-it-yourself program. You can still get it. Go online, go to drtomroselle.com. You can go to rosellecare.com as well and check it out, pick it up. And matter of fact, I still think we have the audio versions. If you go to Audible, you can even download it from what I understand. So you got a couple options there. Make it happen. And we've got a couple new books coming out in 2025. I was hoping that they'd be launched by this fall, but best laid plans of mice and men, and it was one of those things. So let's talk about osteoporosis as it relates to andropause and menopause because of several things. We can say lack of estrogen. So where is estrogen produced when you're not doing it from your ovaries? Same place the guys have been producing it for all this time. It's around their adrenal glands, their fight-flight system, right? So you have these little ductless glands that sit on top of your kidneys, and the outer shell, the cortex, expands, and it produces for you ladies trace amounts of estrogens and progesterones and testosterone. Now, why do I say trace amounts? It's more than that, but it's because you don't need all that hormone anymore because you're done producing children. So the ovaries say, okay, time out. We're on retirement, but we want to make sure that retirement doesn't put you into the old age home. So we have to make sure that we are producing adequate amounts of these hormones. But what happens if you're stressed out? What happens, guys, if you're stressed out and you're grumpy and you're beat up and so forth, and you're suffering from ED? It's all the same thing. It's just that it hits us differently than the ladies in our lives. So, but osteoporosis can be triggered simply because of the fact that you're not producing hormone. Now, there's a lot of other reasons. We're going to talk about that as well a little bit in the second part of the program in the live stream. So make sure you join me. But we have to make sure that we understand there are very specific practices that we have to take place. And, if we're sitting on our butt all the time and we're not moving, guess what? You're going to increase your susceptibility to that. If you're in a constant state of stress, all these talking heads right now going through election season in this country, do you think that is productive for your osteoporosis? No. If you go outside only to get the mail and you don't do anything else, do you think it's going to be a problem contributing to osteoporosis? I can tell you absolutely positively that it is. So we have to look at the hormonal changes that lead to andropause, menopause, and subsequently the increased bone density loss. We have to look at, do we have a thyroid problem? And is that thyroid not working because of, then we look at the parathyroid, right, that we talked about a moment ago. Decreased estrogen levels, can contribute, as we said about it. Now, what does decrease mean? We don't want a lot of it, but they have to be adequate enough to make sure that other things are happening, like your heart's okay, and other tissues are communicating the way it was supposed to. But here's the deal: no estrogen, you don't have bone that is going to stay dense. Do you need to have hormone replacement therapy? Under certain situations, the answer might be yes. But again, we'll talk about that a little bit more. But osteoporosis, just to recap just a little bit, is something, it's a disease, it's a condition that weakens the bone. And it weakens it by pulling the calcium out of the bone. Now, you've heard of osteopenia and osteoporosis. So what's the difference? Only the amount of calcium that's gone from the bone. Osteopenia is less, but you're still subject to fracture. Osteoporosis, obviously, is a place where you've got a lot of bone mass loss, and the symptoms get much more severe. The pain is significant. It's tough to even stand up. You try to lift something and it hurts. You take an x-ray of your spine and the bones are shrunken down. So the cause of osteoporosis is known. If you get into PubMed, they really get it. They understand. If you get into the Townsend letter, if you get into Frontier, a lot of the good nutrition journals, they really understand the mechanisms of what's taking place. So osteoporosis is something that, one, you can prevent in the greatest majority of cases. You don't have to suffer it. You don't have to worry about falling down and busting your hip. You don't have to worry about shrinkage. How is it some people stay nice and tall? If you ever met my wife, Sue's a tall, tall woman, and she's solid as they come, but she also takes really good care of herself. She makes sure she's taking the right nutrients and both getting from a diet. She works out. And so, we laughed over the years because she's maintained her height. When I was in college, I was sitting there somewhere in the neighborhood of just about 5'10", maybe a 16th or an eighth of an inch under it. And she was 5'11". So we always laughed. She was a little bit taller than I am. And then something really queer happened. And it's rare. You're going to say, what? I didn't know that happened. She gets pregnant with my son, and she grows about 2 inches, almost 1.75 inches over a period of time. You say, what? How did that happen? It's a rare situation, but it does happen. I got a son who's 6'4". So what happened to me? I went the other way after almost 48 years treating people and bent over and doing the things, that most people wouldn't do. And is it from osteoporosis? No, my bones are solid. They're really, really solid. But it's because of postural positions and not responding to that environmental stimulus. So we have those pieces as well. So now we're this Mutt and Jeff about 3 inches apart. And it's like, wow, right? Kind of crazy. Well, it happens, but it's not because of hormone on our our parts, it's because of other types of conditions. On her part, it was a genetic, kick in, because this kid of mine is so big and strong and so forth, and came from her, and I'm the guy that was going the other way. But trust me, I got some films taken just to make sure that wasn't the situation. But we don't see it until usually people are above 30. And so we kind of see all kinds of craziness. What we look for on X-ray is what the bone trabecular pattern looks like. The bone trabecular pattern encases the density of the calcium. And when you start seeing this web show up, it tells you that it's weakening. And there's holes in this sponge-like matrix that's sitting there. So if that's the case, it's like, wow, right? So we have to make sure that we know what we're looking at. Then there's some testing. There's a urinary spillage test that we can measure how much calcium you're dumping as compared to normal, because your body's going to get rid of stuff ongoing. And if you understand what's causing it, you can fix it. You can turn it around, which we do all the time at the Roselle Center for Healing. We know how to reverse this. But you have to look at structural patterns. You have to look at neurological patterns. You have to look at hormonal problems, and you put it all together for the individual, for the person that is suffering from this condition. And it's extremely painful in some conditions, but more importantly, here's the deal. If you have osteoporosis, you're hurting, you're in pain, you're hurt all over, up and down that spine, your hips hurt, and muscles hurt too, because your muscles need calcium as well. But when you can fix it, it's like somebody lifted a veil, somebody reversed it, somebody made a difference. We're coming up to the break in the program. I want you to make sure you join me immediately after this on Ageless Health live stream with me, yours truly, Dr. Tom Roselle. And you go to drtomroselle.com, make it happen, but follow me and we'll let you know when it's happening. Okay, so let's go to the other. You get to see this crazy face of man. And remember, we do this ongoingly. One reason only. I truly love you all, and you deserve the information, and I want you to be smarter than all the docs out there. Join me in a second. Let's go. I'll meet you there.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat. If you're in pain and suffering from TMJ, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMJ and how Dr. Michael Chung DDS has successfully treated patients. Visit softtouchdentalcare.com or call 703-319-6990.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Hormones, Menopause, Andropause, and Beyond on Wednesday, November 13th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. That's rosellcare.com.